Paul, welcome to Melbourne, all the way from our UK office. It's really fantastic to have you here today. I'm looking forward to getting your views on our technology in the clinical practice as our Chief Medical Officer. Really looking forward to hearing your views and insights today, so welcome. Can you start by providing some insights into your experience in the digital health sector and your motivations for joining Alcidion?
First and foremost, I'm a clinician, so I qualified in 2003 and been practicing. But early in my career, I really started to enjoy the non-clinical elements of work and looking at service transformation. So moving services out of traditional settings and looking at how we can reimagine care pathways. And it's not long where you get involved in that type of work before you realise the critical role that digital technology has to play. And early on I used to experience digital health innovation as a sort of blocker, as something that's holding us back. But then rapidly you started to see the sort of impact and the difference it could make. I've been really fortunate in my career that I've worked in a range of different settings. So I've worked as a provider into healthcare systems. I've also worked for national bodies as part of secondments or as in roles. And then I've also worked as a commissioner. So working about how do you really enable health technology to succeed and fly. And it was in that role that I started to explore thinking about how digital health innovation can really start to sort of make the difference that I was seeing in the system. And with Alcidion's approach to health technology, really made me confident in seeing that it was an organisation that had the technology, the capability and the understanding to start making a huge difference to the healthcare systems it was working in.
In your opinion, why is it such an exciting time to be working really at the forefront of digital health innovation?
It's exciting, it's also critically important. One of the things that is just a truth for health systems across the globe, they're under significant challenge. There's a lot of pressure and tension in our health systems. We're seeing challenges around productivity with increasing complexity of care and this sort of health inflation concept. That the reality is that it is both exciting but also a critical capability that we need to see health systems adopting it. So being an individual as having an important role in help shaping that, it's incredibly exciting. I feel a real privilege to be in a position where we can think about health technology at Alcidion and how we can deploy that into our use space to start making those differences in the health systems. The opportunity to democratise healthcare and access to the best healthcare is really significant.
I mean, we're really proud at Alcidion that we've played such an important role in really being at the cutting edge of being able to connect the critical information systems and insights to improve clinical workflow and more importantly, patient outcomes. From a clinical perspective, why is this kind of technology so vital?
There's a tremendous strain that we're seeing across clinical footprint globally. Cognitive burden, the amount of time that's spent from an administrative perspective as opposed to engaged in actual direct patient care. So from a clinical perspective, it's critical that we give tools to clinicians to help reduce that cognitive burden, help carry some of the heavy lifting that we're asking clinicians to do. It's also critical that we sort of create this symbiotic relationship with digital health, with this concept of a co-pilot or somebody to assist clinicians in making sure that they're doing the right thing and giving patients access to the best care at all times. And at Alcidion, we've worked really hard with that clinical engagement, finally, to understand what are the problems that the clinicians need solving, really connecting to the problems that people see on the floor day to day as part of their experience of delivering care. So as they say, there's a lot of glass slippers looking for feet, and there's a lot of AI that's been built with specific purposes, but actually by connecting with the workforce, understanding the problems they have to solve, it builds trust, it builds relationship, but fundamentally it builds AI and supporting pathways to make the biggest difference to our clinical workforce and ultimately the patients receiving care.
Yeah, and I'm definitely going to come back to the AI discussion. It's such an interesting one. But what do you see as the key opportunities for the role of emerging technologies within Alcidion's Miya platform in the clinical practice?
One of the key opportunities that we face is ensuring that we lift productivity. post-COVID, we've seen that health systems have really struggled to meet the productivity levels they were pre-pandemic. And so making sure that emerging technology is supporting productivity and supporting that activity is critical. And that transcends across the health spectrum. So whether that be in the EMR, whether that be in virtual care, or in parts of patient pathways that exist outside of typical hospital buildings and into community, we need to make sure that emerging technology is supporting those workflows and making that difference in terms of productivity, in terms of automation, and in terms of how we support clinicians in delivering care. Emerging technology also has a key role in supporting clinical safety. There is a reality that humans may engage in episodes of care with the best of intention, but achieving those best outcomes without human error is really hard to achieve. Many complications, many human error rates have actually persisted since the 70s, and we've not really made significant impact into them. Sometimes we refer to them as never events, but these are sort of clinical safety issues, but even microscopic judgments that take place through patient pathways every day across the globe. Emerging technology can really help support helping clinicians make those right decisions, making them as frequently within the direct patient care, and ultimately reducing patient harm and adverse events.
Now, you hear from the UK, and obviously the NHS is one of our biggest opportunities at Alcidion. What learnings can you share with us around how the NHS is approaching sort of technology within the hospital system?
The NHS is approaching technology in a way that where they're really starting to prioritise and understand the impact it can make. We understand the challenges that are present within systems, so making sure that we can start reducing long waiting times, the challenge that we see across the workforce and burnout that we're seeing. We need to make sure that technology can improve the experience of our clinical workforce. One of the helpful things that we're seeing emerge from the NHS is central policy and vision statements that are supporting a broader AI work. So really making sure we understand, what are we trying to achieve? What do we need the technology to do? And doing that in a consistent and strategic way. So by outlining that vision for how AI can make a difference, that then enables local areas to drive the activity and drive the decision making to deploy the best tools to make an impact. The sort of use cases that we're seeing really being focused on productivity is one, as I've mentioned sort of so far, and trying to look at how we automate and make best use of services. But there's also really interesting work looking at how we can automate some activity. And there's also some really interesting work going on around how we can provide summation and generative AI directly into those clinical workflows.
Now, we were talking earlier around the maturity of digital health in the UK, and I think some of our listeners might be surprised to know that actually Australia is more mature. And so how do you also see the reverse of the learnings that we can take from Australia and the rollout and deployment of our technology here, and how it might be applied to the NHS and the UK market?
It's a really interesting point. I mean, if we reverse back a couple of years in NHS England specifically, around 20% of trusts were still utilising paper as the most significant component of their EPR. And the frontline digitisation programme's gone a long way to uplifting and pushing that digital maturity across the whole of the footprint in England. But what that means is that the EPR market in the UK is actually much more through a deployment phase as opposed to that optimization phase. And when we look at other regions across the globe, the States is one, Australia is another. EPR, EMRs have been really integral to clinical care for well over a decade, 2 decades in lots of instances. And so there's a real maturity of understanding what the EMR does, but there's also great insight as to what the EMR doesn't do, and also what it may not necessarily be the most logical pace in the system to invest your effort and energy to, because the realization of achieving those AI goals through the EMR might actually not be the most strategic or appropriate route. And so I think that there is this parallel of learning for mature systems in understanding what are the hard edges of the EMR, and actually where is it better to partner and to integrate and to bring other tools into your health system to allow you to achieve the inevitable sort of benefits and opportunity that AI has.
Paul, it was great to chat today, thank you. It's always deeply fascinating to gain insights into how Alcidion is supporting clinical practice and staying really true to our heritage of innovating in close partnership with experienced clinicians like yourself. A reminder that Alcidion is a publicly listed company under the ticker code ALC. Thank you.